you do is put one foot on an elevated surface. You can use a wall for balance if you would like. First, we're gonna be intentional about our setup. So we wanna make sure that we're not spilling into our pelvis and our knee isn't locked straight, right? So like this, we wanna make sure we have a slight bend in the knee, and then we wanna make sure that we have our pubic bone tucked to our nose so that, and our lower core is gently activated, so that 10% activation. So from here, we're gonna keep our knee stable. So we're not squatting, we're keeping our knee with that soft bend. The movement is coming from the pelvis. So we're gonna let this pelvis drop down, and then we're gonna bring it back up nice and slow. So we can think about a nice and slow drop and a nice and slow lift. So we're letting that muscle slowly and controlled go into length, and then we're shortening that hip muscle. And what we don't want to do, common compensations that I see with this, is that we either use our back muscle, so that would look like we're doing a lot of side bending, and we would see that our pelvis is tipped forward. So we're side bending and our pelvis is tipped forward. And you're gonna feel a lot of that work in your back as well. The work should be pretty isolated into this hip on the lateral side of the hip, not in the front of the hip. So we wanna make sure it's the lateral side of the hip that's working. So again, for setup, it's intentional, it's slow, it's focused. We think about pubic bone to nose. We find that inner core activation. We allow a slight drop of the hip, and then we come back up.